No.
Okay.
Okay, so I'm just going to check out one thing before we get started. It's up now.
Okay. And we're back.
Would you like to start again? Because I don't think it was playing. It's your choice.
Okay, so what I will do for the sake of time, we had some technical difficulties. Thank you for tuning in with us. We had a very meaningful opening with a moment of spoken word. Perhaps we can put the link in the chat for individuals to view the video following the presentation, but we'll move forward for the sake of time. I want to welcome our listening audience for tuning in. Tonight, we have such abundant resources here from you and some awesome experts from agencies represented. I want to start off by introducing myself. My name is Yolanda Hamilton. I am the Diversity, Equity, and Inclusion Consultant working on behalf of the Garfield Heights City School District. I will also serve as your moderator this evening. At this time, I would just like to acknowledge our representatives from the Garfield Heights School District who are on and responsible for convening this program for tonight. Dr. Gordon Dupree, who is our Director of Pupil Services, Ms. Gina Wilson, who is our Family and Civic Engagement Coordinator, and Ms. Sherry Bailey, who is our Director of Technology. So before we get started, are there any opening words that our district representatives would have for the audience this evening? If not, we can go ahead and move on into our program. So I wanted to start out tonight with just saying, wow, 2020, what a year, right? Everything that we have been presented with definitely has had an impact on our mental health and mental well-being. I wanted to start off tonight by sharing a few key findings from Mental Health America. And as you see me glancing back and forth, I am looking at notes, checking the chats. We want this to be very engaging tonight. And so feel free to put comments in the chat box as we're talking or thoughts about the information that's being presented. And I want to go ahead and share a few of these findings from Mental Health America. Mental Health America reports that youth mental health is worsening. 9.7% of youth in the U.S. have experienced a severe major depression compared to 9.2% of youth last year. And this rate was actually higher amongst more diverse populations, particularly youth who identified as having more than one race. We also know that even before the onset of COVID-19, the prevalence of mental health was increased amongst adults. So Mental Health America reports that in 2017 to 2018, 19% of adults reported experiencing a mental illness. But more alarming, the rate of suicide amongst adults is also increasing. And the percentage of adults in the US who are experiencing serious thoughts of suicide increased by 0.15% from 2016 to 2017. And then from 2017 to 2018, it was reported that an additional 460,000 people were experiencing severe suicidal thoughts. So just let that sit in with you. It indicates that we have a severe crisis going on in the midst of the pandemic, and we can't continue to neglect or have the conversation. The percentage of adults with mental illness who are uninsured, it has increased for the first time. And as we know, many people have had a significant impact from their employment based on layoffs and furloughs from COVID-19. So in essence, all of these things have an impact on the overall mental health and well-being of our families in the district and beyond. And so those statistics to me indicate a need for us as a community to really take the time to take the issue of mental health seriously. And the fact is, as being an African-American woman, I know that in the African-American community, mental health is a stigma. We don't talk about it. We identify ourselves as being strong or persevering through things when really we need to talk with someone. We need to have advice on coping strategies and really face it head on. And so African Americans are less likely to seek out therapy, right? And I think that therapy is a healthy thing. If you need to talk with someone, talking to an expert or professional, that is part of practicing self-care. So tonight, again, we hope that you would engage with us during the conversation. And if you could just start off in the chat tonight, if you are tuning in, and let's just start off even as before we enter into this dialogue with our agency representatives, if you could just put a thumbs up emoji in the chat saying that you will commit to practicing what you need to support your mental health and better self-care for this year. I can't type in the chat, but you see my thumbs up. And I am committed to that for this evening. So at this time, I would like to just welcome our guests who are here, our experts. Again, we have awesome agencies represented. To our guests, I would like to just ask a few house rules. If you could just adhere to keeping your microphones muted when you're not speaking. Also, I want to make sure that we have given ample of time to each of our agency representatives who have taken time to be with us this night. So I ask that you respectfully adhere to the time constraints that I give when I pose questions out so that we can make sure that we're able to get fair questions to all the agencies that are represented. So in starting off, I'm going to ask you in 30 seconds or less, if you could start off by just introducing yourself by giving your name, the agency that you're in, your title, the agency that you're representing, a brief mission, something really quick, like your elevator speech. And also if you could make a brief mention of the insurances that you accept, that would be great as well. So I want to start off with Applewood.
Hello, my name is Brittany McLean. I am a licensed social worker with Applewood, school-based therapist. Insurances that we take all of them pretty much, Medicaid. We currently have a grant, so we are even accepting people without insurance. So that's pretty cool. What else did you say? I think that was it. Anything else? Did I miss something?
I think that was great. Thank you.
Okay.
I would like to go on to Beachbrook.
Hi, my name is Matthew Corbett. I'm from Beachbrook. I'm a supervisor at Beachbrook. I supervise Serena Young, who works in Garfield Heights, and I also supervise Paula Parker, who's in Garfield Heights. We provide, Beachbrook focuses on improving the lives of children and families. We do that through mental health services, individualized counseling, behavioral health therapy. We also offer psychiatric services for medication. Our insurances that we take are all the Medicaid HMOs. We do not take private insurance, although we do, much like the other agencies, we can provide consultation to students who need it if they don't have insurance.
Okay, thank you very much. Belfair?
We take basically all insurance. I work in the homeless and missing youth department, so insurance isn't really involved until we do referrals out to parent and children therapy or Ohio Transitions Project or any of the other programs that we offer. But in the homeless and missing youth department, we've just been doing a lot of outreach to homeless and runaway youth during this time and trying to get them to resources and housing to make sure that they can be safe throughout the pandemic.
Thank you. And really quick, what is your title there?
I'm the street outreach coordinator.
Okay, thank you. Moving on, Big Brothers, Big Sisters.
Hello, I'm Jessica Walters. I'm the president and CEO of Big Brothers Big Sisters of Greater Cleveland. We're a one-to-one mentoring organization, so we match up kids with adult volunteers who've been through our screening process and match them into a one-on-one mentoring relationship. We offer online mentoring right now. It's new for us in 2020. And our traditional program would be, you're picking the big brother or big sister is picking up the child at their home, and then they're going out to do things in the community. So we still are offering that program, but we're really focusing on virtual, and all of our programs are free of charge.
Okay, thank you very much. Catholic Charities.
Hi, good evening. My name is Michelle Kinsella. I'm a care coordinator in Catholic Charities Tapestry program. The program, sometimes heard referred to as Tapestry or System of Care or Wraparound, but really Wraparound is the best way to explain the program. That is what we do. We're wrapping young children and families around services. Kids come to us usually involved with children and family services and or juvenile court. So we're looking to provide services, wraparound services, mental health services, so that that youth can remain in the home and avoid further juvenile court involvement or placement outside of the home, residential or foster care or something like that.
Okay,
So,
thank you so much.
we do mental health assessments on our kids if they have Medicaid. But if they don't have Medicaid, we still provide the wraparound services. But if they are found to have a mental health diagnosis, we'll do some CPST services.
Okay, thank you. We had Catholic Charities. Next is Ohio Guidestone.
Hello, everyone. My name is Lynn Franks. I'm a community counseling supervisor at Ohio Guidestone in our school-based program. We have 4 therapists and 1 community mental health worker that are in the school district. Besides our school-based mental health program, we do have an outpatient counseling office in Garfield Heights. We also provide in-home counseling, substance use disorder counseling, adult services, Pro Kids, which is a diversion program with Cuyahoga County Juvenile Court. And we have psychiatry and also psychological testing. Insurances that we accept is Medicaid, and then we also provide consultation as well.
Okay, thank you. We'd like to go to Heart to Heart. Okay, and Moms and Babies First. Do we have a representative on from Mom and Highland Springs?
Good evening, everyone. My name is Rachel. I am the Senior Business Development Representative for Highland Springs and Changes. Highland Springs is an adult facility in Beechwood that focuses on mental health and substance use treatment. We have inpatient and outpatient group services for adults 18 and over. Changes is a child and adolescent program also focusing on substance use and mental health, and that is group outpatient for children ages 8 to 17. We take most commercial insurances, Medicare, United Healthcare, Medicaid, and for the outpatient only, we take CareSource Medicaid as well, and Buckeye. So I always forget about Buckeye, it's new.
Okay, so we'll go ahead and get started, and I'll start off with a question targeted towards Beechbrook and Highland Springs. As I mentioned in the opening comments, mental health is also often a stigma in certain cultures, and because of this, many parents themselves don't recognize when they or themselves or their children would be in need of seeking out support. So what are some of the signs that would indicate someone should reach out to your agency for help?
I can go first. I would say the things to look for are extreme behaviors. When the child is doing things more than they normally would. And also less than they normally would. They're not enjoying the same activities they really used to get into. If you've got a football player who no longer wants to go play football, or a video gamer who doesn't really want to get on the game station anymore, then that's an indication that they may be suffering from depression. So those are the kinds of things I always encourage parents to look for, is extremes in one end or the other, when they're doing nothing or doing too much of something.
Okay, thank you so much. And Highland Springs, if you could chime in from your perspective.
Yeah, I would say that's a really great advice. A change in behavior, change in attitude. Oftentimes you'll see if someone is struggling, they're on, to Matt's point, they're on a really overexcited end of behaving in a way that they don't normally, or they really withdraw and they don't want to do things anymore. We see that in adults and we see that in kids. You also want to look for things like lying, sneaking around, making excuses. A lot of times that's just trying to cover up a coping mechanism that really isn't positive, like using a substance or self-harm.
Yeah, those are good points. Sometimes masquerading as other behaviors that are not necessarily showing, oh, you're not walking around in gloom and just, overbent and looking depressed, but you're having those other behaviors masquerading. Thank you very much. So my next question is, how can we destigmatize the need for therapy and mental health support? And I would like to pose that question particularly to Applewood and Ohio Guidestone. How can we destigmatize the need for therapy or mental health in 60 seconds or less?
Hi, Applewood here. One of the things that I try to do is just build relationships with these parents, building relationships and letting people know, hey, it's okay to need a little bit of help. It's okay. And some of the things that I tell them all the time is it takes a village. You have to know what's going on and things like that. But definitely building relationships and letting people know that it's okay to need help, or it's okay to need this service, and just letting them feel comfortable meeting people where they are at that moment.
Okay, thank you.
I'm going to agree with all that. You know, it's very important to have those relationships and, you know, letting somebody know that it's okay to ask for help, to find those supports, whether it be, you know, with school staff or, you know, especially if you have a school staff that they have a good relationship with them, normalizing it and letting them know that it's okay to, you know, seek help and talk to someone.
Right. So you mean that asking for help is not a sign of being weak?
Not at all.
Okay, so we heard that.
Could I chime in on that too? I'm sorry.
Absolutely.
One of the things to do though too is not, if someone's suffering from depression and they are worried about how they're going to be, you know, viewed, then you don't, of course we have to label depression for billing and whatnot, but we talk to them about the symptoms and help them and treat the symptoms and not worry so much about the label and what it is. You know, people don't want to be labeled as having depression or anxiety, or you know what I mean? So if you just remove that and just treat the symptoms, that may help destigmatize some of this.
Yes, so I'd like to ask Highland Springs, you wanted to chime in to this also?
Yeah, I think one of the things we talk about all the time with destigmatizing is use the language, talk about it. It's, you know, that is how you normalize something, is to talk about it. It is okay to say the word depression. It is okay to say the word suicide. It is okay to say those words, and people talking about it as if it is just as common, because it is, as cancer, as diabetes, as any other ailment out there. If we just talk about it like normal, we will destigmatize it eventually.
Okay, this makes me think, just for a question personally that I had, where do you think the origin, and this is for any agency that would like to answer, where do you think the origin of the shaming in terms of people coming to grips with having issues with their mental health, where do you think that originated?
I'm sure there's a scientific answer to that or something more appropriate, but if you go back and look at all of our history books, what did they do to people with anxiety and depression 150, 200 years ago? Salem said they were witches, right? People were locked up, people were beaten to death, people had all these terrible things happen to them. So I think that's been ingrained in us for decades upon decades.
Right. So probably like the institutionalized practices around how mental health, individuals with mental health were treated. And I think that would be interesting to delve further into that. So moving on to our next question, and I'm going to specifically pose that to Catholic Charities and Big Brothers and Big Sisters. Like during the pandemic, specifically parents and kids. And so what are some of the, first of all, what are some of the top 3 reasons that someone would reach out to your organization for support?
Well, fortunately or unfortunately, families come to us not through self-referrals. So families come to us through Children and Family Services or juvenile court. So we're not getting families voluntarily.
Okay.
Yep,
And
we have
then
a lot of families that come through. It's a lot of self-referral for us. And I think in our case, it's when parents recognize that they could use a little backup, and they could use someone else to build a relationship and help reinforce some of the things that many of the parents themselves are saying, but it doesn't always sink in. So adding another positive adult role model can be really helpful on some of these things. It just provides another outlet.
Okay, so that's good to know. And I know you mentioned earlier that there are virtual services. So I know that many families in the district probably have children that could benefit from having a virtual mentor or someone that they can talk to during this time. I wanted to pose another question. Some of the agencies during the introductions mentioned that you offer consultation services. Can you just explain, because we want to not assume that the listening audience knows what those consultation services are. If you could just explain maybe in 60 seconds or less, what exactly are the consultation services that you offer? And anyone who would like to respond that provides consults can chime in.
I can go ahead. So I would say, like, if a school staff notices a child experiencing some, concerning behaviors like withdraw, or some, misbehaviors or some anxious behaviors, we can have a therapist meet with them just to kind of assess and see if some, additional services would be necessary or helpful. So that's typically what we do with consultation.
Okay, and of course, those are conducted virtually.
Yes, everything is virtual at this time with Ohio Guidestone.
Okay. Anyone else, any other agencies that offer consultation services would like to chime in?
This is Brittany with Applewood. We pretty much do the same exact thing. Say we get a kid and you're like, they're not really depressed. Maybe something's just going on, but you don't really want to give them a diagnosis, or you're not ready to give them a diagnosis. We do consultation, and you can get 6 to 10 sessions. So it can be every week, or I can spread it out to every other week, or it can be once a month. Maybe they're only having issues at this time, at this class. It just really depends on that child and what was recommended, but it's pretty much the same.
And I'd like to clarify for the listening audience, just if someone wanted to take advantage of reaching out to you all for referrals or resources, they don't necessarily have to have a diagnosis, correct? So you don't have to have a diagnosis to receive therapy, correct? Okay,
Correct.
so I wanted to just clarify that, because I think that's also another miscommunication that many individuals have. And also, I think the question that they might be asking themselves is, how can we get services if I don't even know what I need? Like, how can I get your service if I don't even know what I need? So what would you say to someone that's on the listening end tonight, asking themselves that question?
Sorry to interrupt. I think part of that is part of the consultation services. We call those at Highland Springs and Changes no cost assessments. So what that means is someone can come in 24/7. We are always available, or they can set up an appointment for in-person or virtual, and we do a level of care assessment. So we talk with the person, we find out what's going on. We're not giving you a diagnosis sitting in the chair and talking with us. We're trying to figure out where you are, what's your baseline, what the crisis is, what level your crisis is, and what level of care you meet criteria for. If it's not one of the levels of care that we offer, because we are a more acute facility, so we do offer group programming for intensive therapeutic programming. If you just meet level of care for, an outpatient therapist, we'll give you resources and we'll connect you with referrals. And every agency on here we work with for that exact reason, because we all do something a little bit different.
Okay. And for how long can a person receive consultation services? I know.
For Applewood, we get 10 sessions, 6 to 10 sessions
6 to 10
each
sessions.
school year. So then next school year, say they needed it again for whatever reason and we didn't give them a diagnosis, we can do it again next school year and they'll get another 6 to 10 sessions.
Okay.
And we do about 6 as well.
Okay.
I believe our average is about 5 sessions.
5 sessions. Okay. And Rochelle, I think you said Highland Springs is 10.
No, we're a level of care assessment. So you're going to come in and see us anytime there is a crisis. You can come in. So if a child is struggling and it's once a month that there is an episode that needs addressed or something, you can call us anytime. We don't have a limit. But we evaluate in that moment what level of care they need and get them connected with the right programming. If it's our programming, it depends on what level they come in at and how long they would be with us.
Okay, okay. Thank you. So I want to take a pause here. If everyone is still, tuning in, this is great information and helping you to better have an understanding of how to navigate accessing these resources. And again, Dr. Gordon Dupree and Ms. Gina Wilson, they are both here in the district. You can always work with them to have direct referrals to these agencies. We really want to be supportive of you during this time because we understand, on top of supporting your kids with virtual learning, having work obligations, it is impacting your mental health. And we just want to let you know that there are resources and services that are available. So Ms. Wilson, are there any questions that are coming in from the chat or from YouTube at this time that we need to pause to address?
So some of the questions I was adding in the chat, I just received a question, and someone is asking about family counseling or family services. They want to know if this is just for students or can families reach out and get services as a whole?
At Belfair, we have parent and children therapy. PACT is what we call it. And we can make referrals there if you have any kind of Medicaid care source. And that is parent and children therapy for kids that have any sort of conflict in the household, kind of working through that with the parent. We also have respite homes. So it's a 21-day kind of, we like to call it just a break. So there's, it's not, the child isn't taken out of the parent's custody, but sometimes we find that it's helpful for the child to get a break from the parent. So they can spend up to 21 days in these respite homes where they're placed with a family that's been approved by Belfair. And they kind of work through, then they're also referred to PACT, where they're working through these problems that they might be having in the household with the parent, so that they kind of get that distance that they might need, while also working through their problems with the parent. So they're not just taken out of the household, given a break, and then put back in, but they're actually like focusing on what the stem of the problem is there. So that's always a referral that can be made. That's been very helpful for a lot of families.
Very good. And I know Lynn from Ohio Guidestone wanted to chime in on this.
Hi, yes. It's so super important to not work only with the child, but to also incorporate the child, the parent, and the family or the guardian of the child. You're only going to make so much changes working with just the child. So we do have psychotherapy for families as well as a service. And then also we have a relational skill building program, which helps a parent enhance their skills and their relationship with their child.
Okay, that's good, because we just had a question come up from the audience. Are there services that both parents and children can access together? So that's good. Are there any other agencies that offer services, whether it's mental health support or from the angle of Big Brothers, Big Sisters, and Catholic Charities, that both parents and students could access?
Yeah, Catholic Charities provides community-based, it's called CBFS, community-based family services. And sometimes even in Tapestry, if we're working with a family and they may need something a little bit more intense than what we can provide, we'll refer them to community-based, either individual or family-based counseling. And I can't speak to them as far as what insurances they provide, but certainly they would accept Medicaid, but I don't know about private insurances.
Okay.
Yep. And at Big Brothers Big Sisters, we work primarily with children, but it's important for us to build a relationship with parents as well. So every match that we have, every child that's paired with a volunteer has a dedicated staff person that works with them. So we can also help, if parents would like a referral to services, my staff's very knowledgeable and we can kind of help point people in the right direction, but we don't have a formal program for parents.
Okay. So one other question that came from our listening audience, which I think is very important and also indicates why there's sometimes a reluctance. If parents who need help, and do they have to be concerned about children and family service involvement if they are struggling with their own mental health?
I can take that question. We are mandated reporters. If we suspect there has been abuse or neglect, we, by law, are mandated to report that. However, I always instruct all my therapists and workers that if they're going to make a call like that, they have to talk to the parent first. It's really not good practice to make a report without contacting the parent, letting them know what you're doing. So we try to keep an open and honest relationship with our parents and keep, because engagement, like we said earlier, engagement with the parents is key. So we try to keep them involved and always know what we're doing.
So I'm sorry, go ahead and add. Go ahead and chime in.
I'm sorry, I was just going to piggyback. And it's just something that, like I said, we're always trying to build relationships with families. So even when I meet a family and we're having our session, I explain to them right away, listen, I'm a mandated reporter. If I ever see abuse or neglect, I am coming to you, but I have to report it. And it's just communication patterns. You just got to let people know in advance.
Yep. And I think we were talking before about the stigma of mental health. And I think it's important to recognize that just because a parent is going through a mental health issue it's not the same as an abuse or neglect scenario. So I think even though sometimes we connect those two issues, it really is very separate. And I think it's very courageous for parents to say, hey, I'm struggling with something. And, all of us would probably applaud them for sharing that. And we would work to help them deal with that. And so it's not like you're in trouble for letting us know. And it doesn't necessarily equate to or equal to being like an abuse or neglect scenario at all, pretty frequently.
Okay. So I want to, we have different perceptions or perspectives when you're dealing with different diverse demographics. So let's just say I'm a parent, I am stressed out. I have kiddos at home. I have to help them with virtual learning. I have to go to work. I have to cook. I have to clean. I need to talk to somebody, right? I need to talk to somebody, but there are times because I'm an essential worker, I have to work outside the home. So my kids do have to stay. They're a little older, not like we're not talking about lower elementary. There might be middle school or high school. They need to stay home by themselves. And I might not always have a meal prepared for them, but it's because I'm working. So I just need to talk to somebody because I'm feeling a little depressed and heavy, but I'm reluctant to reach out for a referral because I don't want Job and Family Services involved to take my kids away. I'm doing the best that I can. What would you say to that person on the other end that's feeling that way? Because that's a very real sentiment in this hour.
Personally, she's amazing. You know what I mean? Like, it takes a strong woman to be able to do something like that. You don't have to cook for your child every single day to be a great mom. Honestly, we can get a pack of noodles and throw those in the microwave. It really just depends on what's going on. Children, actually, the state of Ohio, I looked this up before, they don't have an age limit. Definitely not. We're not leaving babies in the home alone, but the state of Ohio does not have an age limit where it says the child has to be 6, 7, or 8 to stay in the house by themselves. It actually says if your child is responsible or if you feel your child is responsible. Does she need help? Absolutely. Do I applaud her for reaching out? Absolutely. But I give her the help that I can find, different community resources. Maybe we can find some after school programs that the kids can go to, some tutoring, some sports activities. You just want to find community resources and just be the rock that she's asking, because it was really courageous for her to ask for help.
I'd also the same as the last, sorry.
Go ahead. No, go ahead.
I think it's the same as the last question you asked about stigma and child services. Just because we talk about it doesn't mean something bad is going to happen. So just because this mom would call us and say, hey, I'm really struggling and I need some help, that doesn't mean that, oh my gosh, the flags go off and it's abuse and neglect and it's a struggling parent, and that's okay. And the better option is for them to call and seek help. The less great option is to not get any help, let it keep getting worse until everything explodes, and then all of a sudden a bunch of agencies are involved. So it's always a great idea to step in and get help. And if there need to be additional resources, any one of us on here, I'm sure, can connect somebody with that. We do that all the time. If you don't know what to do and you just need someone to guide you, call us. We'll guide you in the right direction. We might not be the answer, but we'll guide you.
And taking that one step further, I'm sorry, is we have to destigmatize children and family services. I tell families all the time, they don't want your children. There's no harm in calling them and reaching out when you need help. That's an agency available like every other agency. I try to tell, they're not the baby snatchers. They don't want to place these kids. So reaching out to them isn't always a bad thing. And I think we need to destigmatize that agency as well, because they may have resources that we don't know about. They have access to furniture or clothing or food for families that maybe our agencies wouldn't have access to.
Yeah.
So I don't think we should, I think we should educate families on that agency and not, so they don't have such a bad reputation.
Yeah, I think I hear what you're saying. I think the challenge is in trying to destigmatize that agency. We see things on the news, right? And so that reinforces some of the sentiments that we might have, and then not knowing what those experiences may have been in the past for families that may have been involved, right? And so I think also in terms of when we look at, cultural competent delivery of care, like what constitutes negligence or abuse or neglect, right? It's the perception of the person who's doing the intake or working with that family. So there might be some cultural things that one person may perceive as being neglected. So like what it would be like for providers even to think about that, like what are the standards? What is the proper protocol? How do you engage with these families? Because definitely with Catholic Charities just mentioned, there needs to be education, because definitely there's a reluctance and a fear that people feel as though they're going to lose custody of their kids if they're dealing with mental health issues or if they reach out to support. So definitely a lot of work to be done there. Another question that came about in the chat is that, are any of you, the agencies, able to provide services to students during school hours? The parent says, I do not know what else I can do to give them a push, and I really want them to do better through this virtual learning experience.
Our programming for children and adolescents is during school hours. So our intensive outpatient program is 4 days a week for 3 hours. Our partial hospitalization program is 5 days a week for 4.5 hours. And we do have a teacher on site, so the students are able to keep up with their schoolwork, but they are with us during that programming instead of at school, or they're virtually with us in a different setting instead of in the school setting.
Okay. Anyone else?
At Belfair, we have the Ohio Healthy Transitions Project grant. So in our community independent treatment, which is for older kids, so I would say like high school age, they can be assigned a case manager who can help them with basically anything. And a lot of the times what that need is for school. So they can help them during school hours. It's a super flexible schedule. It would be worked out between the parent, the child, and their case manager. So that's always an option as well if they just need a little bit more guidance or a little bit help getting put on a schedule or anything like that.
Okay. Any other agencies? Go ahead.
Yes, Ohio Guidestone can also provide, during the school day, as long as, the teachers are in agreement and the principals.
Okay.
I believe,
Anyone else?
Brooke, we also provide in-school counseling if allowed by the teachers, and we also do in-home and in the community counseling and work.
Okay.
Can I jump in too?
Absolutely.
We actually don't provide things during the school day, but we really, especially with our virtual programs, are really working with our volunteers to help them understand how they can support in helping with homework and schoolwork. So, if a parent is comfortable, a big or volunteer can communicate directly with a teacher or really understand what's going on and sort of be that kind of extra support outside of school. A lot of our volunteers are college students. So, there's a nice sort of peer aspect there too, where they can work on homework together and, they're doing those things outside of school, but we've added a much stronger focus on school this year because we recognize it's tough, right? Everybody's struggling. So however we can help be part of that squad, we will.
Right. So helping to alleviate the burden for virtual learning or doing homework and having that support. I know many parents could definitely benefit from that. Also, I wanted to pose another question that came from our chat. With the pandemic, is everything, all of the services and everything that you offer, is that solely done virtual, or are any of the agencies tonight, are you offering any type of in-person services?
We're on a mix right now. We have both options.
Welfare is also mixed.
Applewood is also mixed, but it's based on my preference. So if I feel comfortable going out into the community, it's totally fine. And I do that for some of my families that I know need me in person, but majority of our things are telehealth.
Okay.
Catholic Charities has just, not last week, the week before, has requested that we do not do any in-person sessions, unfortunately.
Okay.
Ohio Guidestone is predominantly virtual. If there's extreme circumstances, we could do in person, but predominantly virtual.
Yeah, Big Brothers Big Sisters is a mix too. Where we really are pushing the virtual, and everyone can always do virtual, but we have, if parents are comfortable and volunteers are comfortable, they can meet in person as long as they're, social distancing. Winter's going to make it harder being outside, that type of thing.
Yeah.
Beachbrook's doing a mix of in-person and virtual.
Okay, a mix of in-person and virtual. Okay, so I'm being mindful of the time. We're about at 6:48, so we have about 11 minutes left. I want to just go through a couple of other questions, and I think that these questions would be more relative to all the agencies in general. And however, Ms. Wilson, if there are questions that continue coming through to the chat, we want to definitely take those as well. So I'll go into the next question. I want to learn how to help my child. Do you offer parent education?
We offer education at Highland Springs through Highland Springs through some third-party organizations. So we work, for example, with the Jason Foundation, and they provide parent education. They also provide teacher education, first responder education, but we work with multiple programs to provide that resource, and that is at no cost.
Okay.
Belfair's been having virtual discussions called How Not to Be Distant During Distant Learning. And those are Zooms that I want to say are once a month. I don't think that they're like scheduled too far in advance, but we at Belfair have an Instagram called @helpintheclee. And a Zoom link is always shared on there for when there is virtual meetings, and those are kind of how to get parents involved, and so parents can talk to one another and professionals about how to get their kids involved and how to help them out when they are doing online schooling.
Okay. So how not to be distancing during social distancing.
How not to be distant during distance learning.
Okay. So hard, right?
I know. Yeah, it's kind of complicated, but the Instagram for Belfair is @helpintheclee, and we always share things on there like these kinds of meetings. And there's often resources for parents on like learning and stuff. And then there's also, in addition, like food, clothing, that kind of resources too.
Okay, great. And I saw that one of our providers around relational skill building, Ohio Guidestone. Would you like to speak to that?
Sure. Yes, we have, as I mentioned in my intro, our relational skill building program, which works with the parent and or guardian to, help their relationship with their child. And we focus on defining those appropriate family roles, appropriate expectations of, the development of the child, working on empathy, and then also like personal power.
Okay. Okay. And Highland Springs?
Sorry, I was typing it out. We offer when students are enrolled in our programming once a week, the families come in and have touch bases with the therapist or the nurse practitioner. So we make sure that we're educating the parents on the tools and skills that we're teaching their child and what they need to do at home to continue to support their child and support the family environment.
Okay. Big Brothers Big Sisters, can you share a little about the resiliency program?
Yep, we received some grant funding this year through the Cleveland Foundation in response to the pandemic, and any family that is receiving our services and their child is matched has access to that. And essentially we can help, with whatever that critical need is. If you need support with food, or we've had, a parent that needed a bed or a refrigerator, or, we will either connect you into the right place, or we might be able to provide that until my budget runs out. But we really are looking to pass through as much of that as we can to our families, because as an agency, we were able to access it. So we want to, pass it along to our people.
No, so that's good to know, because we had a parent ask, how do we get access to these resources? So it's nice to know that your organization has grant funding available to help with those basic and necessary needs during this time.
Yeah, and I think probably any of the agencies on here, we could help point people in the right direction to other organizations that provide services, whether that's the furniture bank or the food bank, or, we have a lot of relationships that we can kind of help point people in the right direction too.
Okay, great. So I wanted to give either Ms. Wilson or Dr. Dupree the time to chime in to share with everything that's been shared. What is the process in our district for families or parents to access these services?
What we typically do, Mrs. Hamilton, is a parent will call a school person, maybe a principal, maybe a guidance counselor, a social worker. And when we finally have a recommendation for service from an agency, those referrals flow to Mrs. Wilson. Mrs. Wilson would contact the appropriate agency to provide the service with as much or as little red tape as possible. All they need to do, they can call the school, they can call Mrs. Wilson, or they can call me.
Okay.
Yep. Also, if parents are in need of any resources as it pertains to meeting basic needs, I am also a person that they can contact if they are in need of food, shelter. Again, meeting those basic needs. I work really closely with our families whenever they contact me in making sure that all of those resources are provided. And I will be the first to say, if I don't have a resource in hand, I reach out in the community, I reach out to agencies to see how we can work together to ensure that our families are receiving these resources that they need before moving forward. So I can be a point of contact at any time.
So thank you for, sharing that information with the audience. I do want to mention, because a lot of people have suffered loss of insurance during this time, can any of the agencies speak to any support or services that they would provide for families who might have lost insurance and are not able to, that would present a barrier for them accessing your services?
So right now at Applewood, we actually received a grant. So if the client was already in services and they lost their insurance, we continue to see them. If there is a new referral and they lost their insurance, we'd actually still open them up with do an assessment of PD and things like that and continue on. So we actually have funding at the moment for those that do not have insurance.
And I don't want to speak for the other agencies, but I'm pretty sure we all know how to help people reapply and re-up for their insurance. So if that's a problem the family's having, we're more than happy to help the families connect either online or make a phone call or even go down to apply in person. So.
Okay.
I think it's actually easy because I think they're only taking phone calls at the moment. So they just call.
And wraparound doesn't bill insurance, so that would be a non-issue in our program.
Okay. So again, the information shared here tonight so far, it's just been really enlightening just to think that all of these resources are, in a sense, some, people not knowing what's available to them. And now and now it's your responsibility to reach out and to access those services. And what I would like to challenge the listening audience to do is to, go ahead, reach out to Ms. Wilson. We're going to provide you with her email address and email her tonight to make that commitment to follow through and take care of your mental health and to access these services, because it's going to help lighten the load and you're going to see the difference and the benefit from that. And another question that actually came in is, if we start consultation services, and are you able to help are you able to help parents access insurance during that time?
Yes, so I would say that, that is one of the ways that we do utilize the consultation fund is, we begin to see the student and then we can help the parent in the process, apply for Medicaid, or if for some reason their Medicaid lapsed, we would help get that reinstated.
Okay. So great. So in closing, I would like to just go around in 20 seconds and give each agency the opportunity just to share some closing words with the audience. And so we will start with Applewood.
You started with me both times. No, no, but just in closing, just don't be afraid to reach out for help. I mean, it takes a village to raise a family, and we are your village.
Okay, thank you. And we're going in alphabetical order. So no favoritism, in case anyone was wondering. I think I've been pretty fair. I hope I've been fair in terms of engaging everyone in our dialogue tonight. And we appreciate equally all of our agencies that are helping out our families in our community and in our school district. Beachbrook?
I would say it's a big ask, but I would say parents, they have to be a little vulnerable and they have to be able to say that they need help. And I know that that's hard to do because it may communicate a little bit of what comes across as weakness, but it's not. There's a ton of services here. There's a ton of people all these people have started their careers to help others. And that's what we're here to do. We love doing this. I think you'll like any of us. Once you talk to us and call us, you will love talking to us. You will enjoy us. All we want to do is help. It's a lot of great people. And it was really nice to see so many people that are just trying to help out tonight. So I was really proud to be part of this. Thank you.
Thank you. Belfair?
I would just add on to both of those things that you'd be surprised on what you can get services for. I feel like even at Belfair, like there's services that are added all the time that I don't even know about until a few months later because there's so many agencies and so many resources. So again, like everyone else has been saying, don't be afraid to reach out for help because there probably are resources. Even if you think it's probably doesn't exist, I guarantee you it probably does and someone can help you find it. So.
Okay, big brothers, big sisters.
I would add, I think everybody is struggling a little bit right now. So, come back to destigmatizing. It's okay to ask for help. And, like everyone said, we're all here for that. And we have noticed that parents are struggling. So we actually have a handful of spots available in our program. So if you're interested in Big Brothers, Big Sisters, definitely talk to Gina. Because we've got some volunteers who are waiting to be matched. And, I know families are juggling a lot. So put us on your to-do list because we are available.
Thank you. Catholic Charities?
I was just sitting here thinking, this virtual stuff is kind of awkward and it's unfamiliar. But, one of the big things we do is help families, identify barriers and get over them. Well, looking at this virtual stuff, this is a great way for families to not have to leave their homes for services. They can, put in their earbuds and be on the bus and you can, be having a conversation. So I think trying to look at the bright side of this will help us to access maybe more families that we weren't able to access before because they were embarrassed or they didn't want someone to come into their home and their nosy neighbor seeing somebody knocking at their door or whatever. So looking at the bright side, I think we kind of need to embrace where we're at and share that with families.
Thank you. Ohio Guidestone.
Everybody's always said all the stuff that I was thinking, but, just again, don't be afraid to ask for help. All of us have joined this field for a reason. We really do enjoy helping people. So, don't be afraid to reach out. We have tons of resources. I was going to speak to the virtual, that's just so much more convenient right now, I think. So please reach out to all of us.
Okay. And last but not least, Highland Springs.
I think what I would like to add specific to my agency is that our phones are on 24/7 and we're staffed 24/7 with master level social workers. So if you're not sure what to do and you need some guidance, you can always call us. There is no shame in calling and there's no commitment in calling. We'll advise you what to do. We'll give you resources if we're not the right place for you. We know everybody on this call and everybody in the county. So just reach out, ask for the help. It's okay. It's not shameful. It's the right thing to do.
Great. And a comment from our chat is that this was an awesome meeting and that people appreciated this effort. And so that shows us that our listening audience was engaged. I would like to definitely thank everyone for taking the time out to make this a priority in your work week. And I'd like to close out by quoting some words of encouragement from former First Lady Michelle Obama. She quotes, "To be a good parent, you must take care of yourself so that you have the physical and emotional energy to take care of your family." So let's live that out and let's access these services. Again, we have a slide with the information for Ms. Wilson, and you can do the replay. Her email address, I believe, has been entered into the chat. If you would like to reach out to her, we just encourage you, challenge yourself, do it. If you don't do it in the moment, other things come up and then it comes to the bottom of the list. So email her after this call. She will be sure to follow up with you. Again, thank you for everyone for tuning in. I hope that you have a safe upcoming holiday. And again, stay tuned for more updates that we'll have. It's good to come together like this and share resources. And so we anticipate future programming. Again, thank you and have a good evening.
Bye. Thank you.